Imagine planning the largest healthcare system in the world using nothing but pens, paper, and typewriters. No computers, no spreadsheets, no email. Now imagine doing it while Nazi bombs are still falling on London. That's exactly what happened in 1944, when a handful of British civil servants sat in cramped government offices and designed what would become the National Health Service, the NHS, a system that today serves 67 million people. But here's the part nobody tells you. The romantic story of sketches on scrap paper is both true and completely misleading. What really happened was far more complex, far more bureaucratic, and in many ways, far more impressive than the legend suggests. This is the story of how modern healthcare was born, not in a moment of inspiration, but through thousands of hours of methodical government work during the final years of World War II. Let's step back to 1944. Picture this. Britain is in its 5th year of total war. The country is exhausted. Cities are bombed out shells. Rationing is crushing daily life. Meat, butter, sugar, clothing, even soap are controlled by government coupons. Young men are dying on beaches in France. And in the middle of all this chaos, a group of bureaucrats in Whitehall, the heart of British government, are working overtime on something that has nothing to do with winning the war. They're designing a healthcare system that doesn't exist yet. A system that will offer free medical care to every citizen, from cradle to grave, paid for entirely by taxes. In 1944, this idea is radical. It's borderline socialist. And to most Americans listening to this, it probably still sounds radical today. But these civil servants aren't dreamers or revolutionaries. They're middle-aged men in wool suits, pushing pencils, typing memos, drinking weak tea from chipped mugs. They're doing what bureaucrats do best, turning vision into policy, one tedious document at a time. Now here's where the legend begins to blur with reality. The title of this story says they sketched the NHS on scrap paper, and there's a romantic image that conjures up. Desperate men improvising genius solutions on the backs of envelopes, working by candlelight during air raids, scribbling revolutionary ideas on whatever paper they can find. It makes for a great story. It makes for a great movie scene, but it's not accurate. The truth is more interesting and more relevant to anyone who's ever tried to build something complicated in the real world. Yes, there were sketches. Yes, there were informal conversations and rough drafts. But the actual planning of the NHS was a massive, formal, bureaucratic undertaking that produced thousands of pages of official reports, committee minutes, policy drafts, and legislative text. This was an amateur hour. This was the British civil service doing what it does best, grinding through complexity with institutional discipline. So why does the scrap paper story persist? Because it's a metaphor that captures something true about the moment. In 1944, Britain had no template for what these men were trying to build. There was no NHS to study. There was no universal healthcare system anywhere in the world that worked at national scale. They were designing something from scrap, if you will, using only their intelligence, their experience with wartime planning, and a single visionary document that had been published 2 years earlier. That document was called the Beveridge Report. And if you want to understand how the NHS was really born, you need to understand that report. Because everything that happened in those government offices in 1944 was an attempt to turn William Beveridge's vision into operational reality. Fast forward to November 1942. The war is at its darkest point. The United States has just entered the fight. The Soviet Union is bleeding out at Stalingrad. Britain is hanging on by its fingernails. And into this grim moment, the government releases a social policy report that becomes an overnight sensation. It's called Social Insurance and Allied Services, but everyone just calls it the Beveridge Report, named after its author, Sir William Beveridge, a 63-year-old economist and social reformer. The report is dense, 300 pages of policy analysis and recommendations. But its core message is simple and electrifying. After the war, Britain must attack 5 giant evils: want, disease, ignorance, squalor, and idleness. To defeat disease, Beveridge proposes something unprecedented: a comprehensive national health service, free at the point of use, available to every citizen regardless of income. No bills, no insurance forms. No one turned away because they can't pay. Just healthcare as a right of citizenship. The Beveridge Report sells hundreds of thousands of copies. People queue up to buy it. It's discussed in pubs and factories, in bomb shelters. British soldiers fighting in North Africa read it and debate it. Why? Because it offers something Britain desperately needs in 1942: hope. A promise that when the war ends, life will be better. That all this sacrifice will lead to something more than just a return to the poverty and inequality of the 1930s. The report taps into a deep well of resentment about how healthcare worked before the war, or rather, how it didn't work. For most working-class Britons, seeing a doctor meant paying out of pocket, which meant many people simply didn't see doctors. They suffered. They died of treatable conditions. Hospitals were a patchwork of charity institutions, local government facilities, and private clinics. If you were poor and got seriously ill, you were often just out of luck. Beveridge's proposal isn't just policy reform. It's a moral reckoning. But here's the thing about visionary reports: they don't implement themselves. The Beveridge Report is a blueprint, not a building. Someone has to turn those 300 pages of policy recommendations into actual legislation, actual budgets, actual institutions. Someone has to figure out how to take a healthcare system that's fragmented across hundreds of independent hospitals, thousands of private practitioners, and dozens of local government agencies, and somehow merge it all into one unified national service. That someone is the British Civil Service, and specifically the Ministry of Health. And this is where we step back into those offices in 1944, where the real work is happening. The Ministry of Health in 1944 is not an impressive place. It's a warren of cramped rooms in a commandeered building in central London. The furniture is battered. The filing cabinets are overflowing. There's no air conditioning, no central heating that works properly. In summer, the offices are stifling. In winter, they're freezing. Secretaries type on heavy manual typewriters that clack and ding like machine guns. Every document is produced in multiple carbon copies, smudging the fingers of everyone who handles them. Communication happens by memo, by telephone, by messenger carrying files and folders from desk to desk. This is low-tech, high-friction work. And yet, in these unglamorous conditions, a small team of senior civil servants, maybe 24 key individuals, are engaged in one of the most ambitious acts of social engineering in modern history. Who are these men? They're career bureaucrats, mostly in their 40s and 50s. Men like Sir John Houghton, who serves as permanent secretary at the Ministry of Health. Men like Sir William Jameson, the chief medical officer. Men whose names you've never heard, because civil servants don't get famous. But these are serious, capable administrators. Many of them cut their teeth on wartime planning, coordinating evacuations, managing rationing systems, running emergency medical services during the Blitz. They've learned how to move resources, how to coordinate across agencies, how to implement policy at scale under pressure. Now they're applying those skills to a peacetime challenge, building the NHS. Their task is staggering. They need to answer questions like, how do you nationalize hospitals without triggering mass resignations from doctors who value their independence? How do you pay for universal health care when the country is essentially bankrupt from fighting a 6-year war? How do you distribute medical services fairly across cities, towns, and rural areas that currently have wildly unequal access? How do you balance local control with national standards? How do you integrate dentistry, optometry, pharmaceuticals, mental health services, maternity care, and preventive medicine into one coherent system? Every one of these questions has political, financial, legal, and logistical dimensions. And remember, they're doing this with 1944 technology. No computer models, no databases, just paper, pencils, and human brainpower. This is where the scrap paper metaphor has a kernel of truth. In the early stages before formal policy drafts are written, there are absolutely informal discussions, rough sketches, back-of-the-envelope calculations. Senior officials meet in small groups, brainstorming structure. They draw organizational charts on notepads. They sketch out funding models on memo pads. One civil servant might say, "What if we divide the country into regional health authorities?" And someone else grabs a pencil and draws circles on a map. Another might ask, "How do we keep doctors from fleeing the system?" And someone scribbles notes about salary structures and professional autonomy. This is the creative phase, the experimental phase, where ideas are tested and discarded and refined. It's informal, it's iterative. And yes, some of it probably happens on whatever paper is handy, which, in wartime Britain, often means reused paper, scraps, the backs of old forms. But here's the crucial point. This informal brainstorming is just the beginning. Once ideas are developed, they move into the formal machinery of government. They become draft papers, which are reviewed by committees, which produce minutes, which are revised into policy proposals, which are reviewed by more committees, which are revised again into legislative drafts, which are reviewed by lawyers, which are revised into white papers, official government policy documents, which are then debated in Parliament. This process is slow, meticulous, and exhaustively documented. By the time the National Health Service Act is passed in 1946, the legislative text alone runs to dozens of pages, supported by hundreds of pages of explanatory material, all of it typed, copied, filed, and archived. This is not scrap paper. This is the full weight of state bureaucracy in action. Let's zoom in on one specific challenge these civil servants faced. Hospitals. In 1944, Britain has about 3,000 hospitals, and they're a chaotic mix of ownership and funding. Some are run by local governments. Some are run by charities. Some are run by religious organizations. Some are essentially private businesses. They range from modern, well-equipped facilities in major cities to tiny rural cottage hospitals with a handful of beds. Quality is wildly inconsistent. Funding is unpredictable. And crucially, most of these hospitals are independent institutions with their own boards, their own endowments, their own traditions. Now imagine you're a civil servant tasked with integrating all 3,000 of these institutions into a single national system. Where do you even start? The answer, as it turns out, is compromise. The civil servants studying this problem in 1944 quickly realized that full nationalization, government ownership of every hospital, is politically impossible. The voluntary hospitals, especially the famous teaching hospitals in London, will fight it tooth and nail. So will the doctors, many of whom have honorary positions at these prestigious institutions. So the planners sketch out a middle path. They propose dividing hospitals into different administrative tiers, teaching hospitals with special status, regional hospitals providing specialized care, and local hospitals providing general services. They draft funding formulas to equalize resources across regions. They design oversight structures that preserve some local autonomy while imposing national standards. It's a compromise, but it's a workable compromise. And all of this happens through countless meetings, memos, and marginal notes on draft documents. It's painstaking, it's exhausting, and it absolutely requires the kind of institutional discipline that only a mature bureaucracy can provide. Now let's talk about doctors, because this is where the NHS almost dies before it's born. British doctors in 1944 are not, by and large, enthusiastic about the idea of a national health service. Many of them are downright hostile. Why? Because they see it as a threat to their independence, their income, and their professional status. Under the old system, Most general practitioners operate as small businessmen, running private practices, charging fees, competing for patients. It's competitive, it's insecure, but it's also autonomous. The idea of becoming salaried government employees horrifies many of them. The British Medical Association, the doctors' professional organization, campaigns aggressively against the NHS proposal. They warn of state medicine, of bureaucratic interference in clinical decisions, of the death of medical professionalism. The civil servants working on NHS planning in 1944 are acutely aware of this problem. If doctors refuse to participate, the whole system collapses. So they spend enormous amounts of time trying to find compromises that will bring doctors on board. They sketch out different payment models: fee-for-service, salaries, capitation payments based on number of patients. They draft language guaranteeing clinical autonomy. They propose letting GPs remain technically self-employed while working within the NHS framework. They design appeal mechanisms so doctors can challenge administrative decisions. Again, this is all happening on paper, draft after draft, revision after revision, trying to find language that satisfies both the reformers who want universal health care and the doctors who want to preserve their professional independence. It's not glamorous work. It's tedious negotiation, translated into bureaucratic prose. But it's absolutely essential. By late 1945, the war in Europe is over. Britain has a new government, a Labour government led by Clement Attlee, elected in a landslide on a platform that includes implementing the Beveridge Report. The new Minister of Health is Aneurin Bevan, a fiery Welsh socialist with working-class roots and no patience for half measures. Bevan takes the work that civil servants have been doing since 1942 and pushes it forward aggressively. He's willing to fight the doctors. He's willing to fight the hospitals. He's willing to spend political capital to make the NHS happen. And crucially, he has the detailed policy work, the legislative drafts, the organizational plans that civil servants have been developing for years. Bevan didn't create the NHS out of thin air. He took the scaffolding that bureaucrats had built and turned it into law. The National Health Service Act passes Parliament in November 1946, but even then, the NHS doesn't launch immediately. It takes another 18 months to implement, 18 months of converting plans into reality, of negotiating final terms with hospitals and doctors, of setting up administrative structures, of printing forms and hiring staff and training personnel. The NHS finally launches on July 5, 1948. It's a Monday morning. Across Britain, people walk into doctors' offices and hospitals and for the first time in history, receive health care without paying a penny. No bills, no means testing. No insurance claims, just care as a right. It's a profound moment, and for millions of working-class Britons, it's the fulfillment of a promise made during the darkest days of the war. Now, let's step back and look at what actually happened here, because the real story is more instructive than the legend. The legend says the NHS was sketched on scrap paper, implying that it was born from improvisation, from scrappy resourcefulness, from making do with limited tools. And there's truth in that image. The early planners absolutely worked with limited resources. They worked in difficult conditions. They worked without modern technology. But the deeper truth is this: the NHS was born from institutional capacity. It was born from the ability of a professional civil service to take a visionary idea and translate it into operational reality through thousands of hours of meticulous, unglamorous work. The scrap paper is a metaphor for starting from scratch, but the actual execution required the opposite of scrappiness. It required bureaucratic discipline, legal expertise, political negotiation, financial planning, and administrative coordination at scale. Why does this matter, especially to an American audience in 2025? Because the story of the NHS is fundamentally a story about state capacity, about whether government can actually build and run complex systems effectively. And that's a live question in America today. The United States has spent decades debating healthcare reform. The Affordable Care Act, passed in 2010, expanded coverage but left the system's basic structure intact, a fragmented mix of private insurance, employer-based coverage, and government programs like Medicare and Medicaid. Many Americans still lack coverage. Medical bankruptcies still happen. The system is expensive, inefficient, and unequal. And every few years, politicians propose more ambitious reforms: Medicare for all, single-payer systems, public options, and every time, the debate hits the same wall. Can government actually do this? Can bureaucrats actually build and manage a system this complex? Or is it a recipe for disaster? The British experience from 1944 to 1948 offers an answer. Yes, government can do this, but only if it has the institutional capacity and the political will. The NHS didn't happen by accident. It didn't happen because a few people had good intentions. It happened because Britain had a professional civil service capable of translating vision into policy, and a political leadership willing to fight for implementation. And here's the uncomfortable truth. The United States in 2025 has weaker state capacity than Britain had in 1944. American government is more fragmented, more politicized, more dysfunctional. The civil service has been hollowed out by decades of budget cuts and political attacks. The idea of career bureaucrats spending years developing detailed policy plans, insulated from political interference, sounds almost quaint today. And without that capacity, ambitious reforms are much harder to achieve. But there's another lesson here, and it's about the gap between myth and reality. The scrap paper story is appealing because it's simple, because it fits our cultural preference for entrepreneurial improvisation, for individual genius over institutional process. We love stories about lone innovators having eureka moments. We're less interested in stories about committees and working groups and draft memos. But most real change, the kind that lasts, the kind that scales, doesn't come from eureka moments. It comes from exactly the kind of grinding, methodical, collaborative work that those civil servants did in 1944. It comes from people who are willing to sit in unglamorous offices, wrestling with details, drafting and redrafting documents, negotiating compromises, building coalitions. That's not romantic, but it's real. The NHS that launched in 1948 wasn't perfect. It faced immediate challenges, overwhelming demand, budget overruns, staffing shortages, conflicts between national policy and local implementation. Some of those challenges were predictable. Some were surprises. The planners in 1944 couldn't foresee everything. But they built something that worked, something that survived, something that grew. Today, the NHS is one of the world's largest employers, with 1.3 million staff. It handles over 1 million patient contacts every 36 hours. It's been reformed, reorganized, and restructured dozens of times over the past 75 years. It's chronically underfunded and perpetually controversial, but it still exists. It still delivers free healthcare to every British citizen. And it still traces its roots back to those civil servants in 1944, working with pens and paper and typewriters, turning vision into policy, one document at a time. For an American audience watching the ongoing debate over healthcare reform, the story of the NHS offers both inspiration and warning. Inspiration, because it proves that universal healthcare is not a utopian fantasy. It's an achievable goal if you're willing to do the work. Britain in 1948 was far poorer than America today. It had just fought a devastating war. Its infrastructure was damaged, its economy was weak, its resources were stretched. And yet it built a healthcare system that covered everyone. If Britain could do that in 1948, America could certainly do it today. But the warning is this: building something that big and that complicated requires more than good intentions. It requires institutional capacity, political courage, and a willingness to embrace complexity rather than oversimplify it. It requires people who can sit in rooms and work through 10,000 boring details until they get the structure right. It requires patience, persistence, and a tolerance for bureaucracy. The scrap paper story is a useful myth because it reminds us that great things can start small, with limited resources, in difficult circumstances. But let's not mistake the myth for the method. The NHS didn't succeed because it was sketched on scrap paper. It succeeded because professional bureaucrats took those early sketches and turned them into detailed plans, and because political leaders took those plans and turned them into law, and because thousands of healthcare workers took that law and turned it into operational reality. That's the real story. It's less romantic, but it's more useful. It means that in 1944, in the middle of a war, a group of people decided that the future could be better than the past. They decided that healthcare should be a right, not a privilege. And then they did something much harder than dreaming. They figured out how to make it real. They worked through the details. They built the structure. They navigated the politics. They created something that lasted. That's the story worth remembering. Not the scrap paper, but what came after. The thousands of hours of work that turned a vision into the National Health Service. That's how you build something that matters. That's how you change the world. One memo, one meeting, one compromise at a time. Until finally, one Monday morning in July 1948, the whole thing goes live and history changes. Not because someone had a brilliant idea, but because people did the work to make the idea real. Because if we want to solve big problems, whether it's healthcare, climate change, infrastructure, or anything else, we need to understand how change actually happens. Not through magic or improvisation, but through the hard, unglamorous work of building institutions that can turn ideas into reality. So the next time someone tells you the NHS was sketched on scrap paper, remember what that really means.